one of the reasons why we started this program, and we started, was not just to help the community, but was also to show that homeopathy and homeopaths can be part of the public health service.
Dr. Loretta, I'm going to start with you. I want you to tell us more about the organization. Give us a little background of the organization. Then after, we'll talk about the services you guys are rendering within the organization.
Okay, cool. So the Khula Natural Health Centre is a registered NPO. It was started outside Khula. It's a registered, the Khula Natural Health Centre is a registered non-for-profit organisation. It was started in Khula village outside St. Lucia in rural KZN by two homeopathic doctors, Dr. Nicoline Portretter Steiner and her husband, Dr. Manuel Steiner. They were both living in Switzerland at the time, and that was the first of the Khula clinics. Work that they do there and the way in which they serve the community, that I decided to start a similar initiative in the Eastern Cape, outside East London, in Necha village, and that's how Khula Eastern Cape was founded. So I do it under the auspices of Khula Natural Health. Okay, so we now have we have a Khula Natural Health Centre in the Eastern Cape, and we also have a satellite in Limpopo.
Okay. Doc, I want you to tell us about, you did say translators are employed from the community. So meaning that there is the impact that the initiative brought within the community is very much huge. I want you to elaborate on services provided by the facility and how they've impacted the community.
Hi,
yes.
So ndizothetha nge-services inkonzo esiza nazo siyikhula healthcare facility.
Sure.
So thina okokuqala i-employment esiyenzile, because abantu abaqashiwe abasebenzayo as translators, since it's indawo of diversity, so sine-translators kusebenza ogqirha bathathu, uDr Loretta, nguDr Samuel, noDr Bolobolo ondim. So kube khona ke i-translators for abanye odoctor abangakwazi ukuthetha isiXhosa, since indawo that is Xhosa dominated. So ke ngoku sinaleyo employment eyenzekayo, futhi services esizisayo. We have natural and complementary medicine,
okay,
in treatment and management of acute and chronic diseases. Acute illnesses emzimbeni uphila kanjani, also consider the emotional being of a person. Then sikwazi ke ngoku ukudibanisa iyeza okanye amayeza okanye amachiza afanelekileyo ukuze akwazi ukuziphilisa yena umuntu. Also treatment options zethu include nutritional and lifestyle guidance, because ekugqibeleni ukuphile indlela esiphila ngayo yeyona i-affect ukuthi sigula kanjani okanye sibe. Okunye i-services esiziprovider sinayo ne-soup kitchen eyenzekayo efacility yethu. Ngeli xesha abantu basalinde ukuthi bakwazi ukubonana nogqirha bafumane into yayo esiswini. So ayiyonceha kuphela ke esijongileyo, sijonge inceha kanye neziphaluka.
Doc, okay, you can continue, Doc, it's fine, it's okay.
So inceha nezinye indawo ezisurrounde inceha, njengoba ikhula EC ngokomnqweno wethu ukuthi sikhule sikwazi ukuvisitha kwezinye indawo ezifana neQueenstown, zonke indawo zase-Eastern Cape ephondweni sikwazi ukujikeleza.
I want us to go back. I see that the name of the facility is Khula Natural Health Clinic. I want us to stick on that natural. And while you were explaining about the medication and the services you guys are providing within the organization, Dr. Bololo, you did mention, Dobana, you guys have Amapilisa Natural. So can you please elaborate more on that? Or I'm not sure if it's going to be Loretta who is going to explain that for us.
No,
it's okay. You can go ahead, Sisi.
So xa sithetha nge-natural ngamachiza enziwe I don't know noma ndithi ngamachiza noma
yes, ngamachiza, yes, ngesixhosa. Akogaki. Oh, okay.
So, okay. Ngamachiza enziwe ngezityalo kunye nee-minerals ne awana side effects incedisana nomzimba ukuthi ukwazi ukuzihilisha wona.
Okay.
Because ekugqibeleni sinemizimba yethu ine-cells amasotsha aziphilisa sithi xa sigula kuthiwa thatha into ethile just to stimulate ukuthi ukwazi ukuzihilisha wona umzimba wakho.
And I think that resonates with us in Eastern Cape. Yeah. I think that resonates us with Eastern Cape because we grew up using natural herbs. Those herbs that doesn't have preservatives, they are just natural. So hence I wanted to elaborate more on that. You can continue, sis.
So bendisazama ukucacisa ukuthi okay i-homeopathy because ngamanye amaxesha igama le-homeopathy it's something that is foreign to us asi-understand noma ukuthetha ukuthini. Okunye into endiye ndidibane nayo ukuthi xa usithi uyi-homeopathic practitioner okanye homeopathic doctor bayabuza uba uspecialize ngantoni. So it's not necessarily like a speciality ukuthi ukuncedisa it's more like i-GP general practitioner and the general practitioner I specialize with anything. So siyakwazi ukureferra if your case needs to be a specialist.
Okay, that's great. Dr. Loretta, yes, do you have something? Do you want to add something on what was the doctor said?
Yes, I just want to add about the naturalness of the medication because of the way in which homeopathic medicine is made. And because it is a natural medication, it also is safe to use with ordinary Western medicine. So, very often people think that it's got to be one or the other. It absolutely doesn't have to be, because if a patient, for example, has got diabetes and they are taking diabetes medication that they've gotten from the Department of Health clinic or from a doctor, then we can still use homeopathic treatment to can't actually get help for at the other medical facilities. So those patients their treatment will be unable to continue. And they will have a loss of quality of life. And obviously the ladies at the Lingalectus Soup Kitchen that we support when we are there during the month, they will also lose our support. So those are the most obvious consequences of what is going to happen should we not be able to continue.
With this a challenge that you guys are experiencing at this particular moment, are there any plans to explore additional funding sources or partnerships to ensure the facility long term?
Yes, absolutely.
Okay.
So just a little bit of context. The Khula Natural Health Centre that started in KZN is essentially largely funded by some South African funders, private funders, as well as a foundation in Switzerland. And when I wanted to start the Khula EC branch, obviously they had no experience of me, the Khula Foundation. They didn't know whether I was serious, whether I was really going to pull it off or not. And so the agreement essentially was, and also with our regulating council, that I have to have enough funds to run the facility for at least 6 months, which we absolutely did. Otherwise, we wouldn't have started. So with the help of donors, with the help of the Homeopathic Association of South Africa, we managed to accrue enough funds so that we could definitely be open for at least 6 months. So we managed that for almost a year. And now that we have the proof of concept going, now that we actually have it going, we've got patients coming, we've got patient testimonials, we've got patient numbers. Now it's going to become easier for us to secure more funding. So there's a possibility of the funding partners that fund Khula Natural Health Centre in KZN bringing us on board into their funding budgets. As well as new funders that we are exploring. So, for example, the Lotto is somebody that we've applied for funding for next year. And there are 1 or 2 foundations in South Africa that we've also applied to for funding. Our association, I just want to go back a little bit and just clarify that homeopaths are registered and regulated in South Africa by the Allied Health Professions Council of South Africa. And that's why we get to use the title of doctor. And our studies, we study a master's degree in homeopathy, which enables us to work as diagnosticians. So we can diagnose and we can treat diseases. We also have been trained in counseling because we take the whole patient into consideration. So our association belongs to an international association called the Liga Medicorum Homeopathica Internationalis, which is an international association of homeopaths, and we have received some funding support from them as well. So as we grow of homeopaths, and we have received some funding support from them as well. So as we grow, so our collaborations with national and international funders increase. And obviously, the more we can show the benefit that we're actually giving to people on the ground and in the communities, the more it is that we can actually grow our funding. Our immediate plight was that we sort of ran out of funds to actually be operational for September, October through to the end of the year. Mm-hmm. And that's what was really driving our funding appeal. Obviously, if we can get funders that buy in for longer, that would be hugely helpful to us, because homeopathy is not part of the public health system. And that's another reason why we have the Khula clinics. Because we want to show...
Sorry, Loretta. We need to go to the news quickly. I want you to pause right there. So, and then when we come back, I also want you to respond to this question. But are there any system or support system in place for patients who may be affected by the facility? But we will respond to that just after the news. Right, imizuzu masiyenze ube mnyekha ngoku betle insimbi yaka 10 o'clock. Ladies, we are back. Dr. Loretta, I had to stop you because we had to go to the news. I want you to continue where you left off, and then I will repeat my question right after you are done.
Sure. So, I mean, I think I was more or less done. What I was really saying is that we have potential for additional sources of funding, and that one of the reasons why we started this program, and we started, was not just to help the community, but was also to show that homeopathy and homeopaths can be part of the public health service, because homeopathy is really cheap, it's very effective, the cost per patient is much cheaper than it is in an ordinary government facility, and the more we can grow our Khula footprint, the more we can work together with government in order to bring health to communities that struggle to access good quality health care.
Doc, what support system are in place for patients who may be affected by the facility if you guys are forced to close?
Okay, so I want to start off by saying that we have no intention of closing indefinitely. Okay, so our plan is not to close. And we do have contingency plans in place, which we've managed to put in place. It's been a bit of a mad scramble over the last 2 months. But essentially, I want to assure you and the public that we are actually not going to close. Our appeal for funding is it's long-term, but it is really in the short term to just bridge us through the next couple of months to the end of the year. So worst case scenario is that we may need to reduce the services that we offer for maybe a month, maybe 2 months, but we've got absolutely no plans to close whatsoever. So we will still be able to support the community. We're not just going to leave people hanging. That will never happen.
Yeah. Dr. Bolobolo, I want you to come back to you. You are the person who sebenza nababantu at a very much close level. Did you guys break the news to them that there are chances yokbana ningavala and bathini xa nincokola nabo?
No, not okwangoku.
Okay.
But ngoba sisoloko siba khona aside sibaxelele.
Can you take us to the process, maybe? What can one do in order to do that?
Absolutely. So anybody who's interested in supporting our cause can contact me directly, and I can give them banking details and stuff if they want that. But we do have a funding campaign that's run on the Back a Buddy platform.
Okay.
So it's if you put into any search engine online, Back a Buddy, all one word, It'll take you to the BackaBuddy site, and then on the top of the BackaBuddy site, there's a search function. If you just type in Khula Natural Health, I actually tested it before I came on. If you type in Khula Natural Health Centre, you'll see two campaigns. One is for Khula Natural Health EC, and one is for, just a general Khula Natural Health campaign.
Are there any potential plans to partner with the government, private sector, to make sure that we don't experience the same problem going forward?
Absolutely. So, as I explained, one of the reasons why we have Khula, why we founded Khula Natural Health, not just in the EC but in the country, is so that we can provide services, primary healthcare services in rural areas, and also so that we can show that we can decrease the burden of healthcare. I just want to mention a few figures. At Khula KZN, they've been open since 2017. They've had more than 45,000 patient visits.
You lie.
That's a lot of people that have come to a facility. And all those people who've used that facility decreases the burden of healthcare on the government services. So we are actively engaged with government. We are actively engaged with the MECs of the provinces in which we work, so that we can bring the Khula Natural Health Centres to the attention of officials, so that we can work together and we can partner.